I'm Abdul Kabir. I'm an internist. Our practice is located in Monroe, Michigan, which is a blue collar city, has a population of about 60,000 counties, 150,000. Uh, we have one hospital in the county. That's the only hospital. And all the labs are done at the hospital. We used to have outreach lab in our office, but after COVID, it closed down. So all our patients go to the hospital for blood work. Uh, our EMR is eye patient care. We have had eye patient care since the beginning. I think around 2008, 2009 is when we got it. Uh, I am independent, solo practitioner. I do have a PA and a nurse care manager, and then we have medical assistants and support staff. Our patient population is about 40% is commercial, 60% is Medicare Advantage plans. If we can go to the next slide. So we have about 240 patients in MCT2D, and we have a capture rate of about 95% on urine microalbumin. Next slide. So keys to success. I mean, I think for us, uh, as a physician, buying into the program and believing in it, and then educating our staff, and staff involvement and staff engagement is the key. Uh, we have EMR that tracks all the measures and uh, flags it in red. So basically, MAs do all the heavy lifting and day-to-day work. They go in and pre-populate the chart, and they order all the tests that are highlighted that need to be done. So by the time I get in, it's already done. So can't take credit for doing all those urine microalbuminurias. Um, so it's basically the workflow. Then at the back end, we have EMR has a built-in registry, so we can add things, remove things, and it can track things. So uh, at the end of the year, we do run reports and then do gap closures and outreach. And my care coordinator is the one who tries to get it done at the last minute. Then we also have MAs and front desk that we give lists to that do the call outs and reach out to patients. Um, so basically, it's a team approach. As far as patients are concerned, I mean, they do ask why you're doing it. Recently, we started doing urine microalbuminurias for hypertensive patients too. So they're the ones who question, like, you never did this before, why are you doing this now? And usually it's the MA that gets that question, and she tries to explain them, and then I come and I reinforce, and we don't get too much pushback from patients. Next slide. So that's pretty much the same, that, everybody is proactive and do outreach. Uh, for barriers, I mean, the biggest challenge as a solo practitioner, independent physician I face is staff turnover. You teach somebody, they start uh, doing what they need to do. The system is like the whole office is running smoothly, and then you find out that one person leaves, and then you get somebody else, and getting them on board, educating them, and by the time they're performing, it's like 6 months. You're 6 months behind, and all your quality scores are down in the gutter. So that is the biggest challenge that we face to when there is staff turnover. Um, I mean, we don't do urine microalbumins in our office. We send them to the hospital. We never had any issue with that. Uh, Patients, again, if you explain them in simple terms, like why you're doing the test. I mean, what we say is, like, the blood test does not catch kidney disease till much later. But if we do this test, we can pick up kidney disease in much sooner, and we can do some interventions to make sure that you don't end up with kidney disease. And once you explain that to patients, they pretty much are okay with doing it. Um, Social determinants of health do matter. I mean, obviously, um, depends on your social, I mean, level of education of patients, their profession, whether they have insurance or they are uninsured, all influences, lab testing. Um, Next slide. So as I said, like, our staff does a lot of work around this, and I mean, as a physician, I don't do much of the heavy lifting. Sometimes patients do question why you're doing this. Would my insurance pay for it? And I usually say, yeah, it's covered. Your insurance actually wants it done. Uh, so so we don't get too much pushback on this. Um, Next slide. And we just talked about that cash paying patients would have a challenge, and um, but otherwise, I mean, I think that most people just comply. Next slide.
That is your last slide.
Okay. Well, so
All
that's
right,
about it for me.
I'm gonna mute you for now because I'm getting some feedback. Thank you so much, Dr. Kabir.